Morning, folks.
Morning.
Good morning.
Hello.
Doing my usual adjusting here. Okay, I see Ms. Yang, Ms. Prince, Ms. Naker, Mr. Tao. Fantastic. It looks like we've got a fairly large group. I might just wait 1 minute and see if we can get a couple more. I know last night was quite a night. Yes. I do not see Ms. Hadeen. Now I do, like magic. Okay, 1 second and we'll get rolling. Okay, I'm going to use my headset. I think the sound quality is better, so I just switched over. Holly, can you give me a thumbs up if you're hearing me? Okay, awesome. All right, so we have a good group here in the house, and so we will get started here, and our St. Paul City Council Budget Committee will come to order. Good morning, folks. It is a beautiful fall day in November after we had a kind of a sudden deep, dark winter in October. So that's one lovely piece of news. We are hearing today in the continuation of our budget conversations from St. Paul Ramsey County Public Health and its director, our director, Kathy Hadeen, as well as from our OTC department, Director Sharon Kennedy Vickers is here to present. Ms. Hadeen, just as a matter of kind of procedure, what we've been doing is taking questions along the way. Rather than hold them up till the end, just because sometimes it's a little thing that can be quickly answered. If we ask a question that you're getting to in a slide or two, just go ahead and tell us to be patient and that you'll get to it in a slide or two, and we can hold on to our horses. But I will keep an eye on my colleagues and see if there's any questions so you can focus on your presentation. And then we may also have questions at the end, and then sometimes we have questions after the presentation is over, and we will follow up through our Chief Budget Officer, Holly Houston. So it's wonderful to have you here today. We went to you as a interim director, and thankfully you became a director in short order. I know you've been doing fantastic work, and we appreciate so much your leadership in this very unusual time. So thanks for taking time out of your intense schedule to be here to present to us. It's wonderful to have you here. And I will turn things over to the Director of Ramsey County St. Paul Public Health, Kathy Hadeen. Welcome.
Thank you, Council President Brenmon. I appreciate that. And if you haven't heard, I also have been recently named the Deputy County Manager of Health and Wellness. And so I wanted to give you an update about that, as well as, of course, we're a little bit different than the other departments within the city and fiscally sit outside of the city of St. Paul, and the budget resides within Ramsey County. So I have prepared remarks for all of you. I don't have slides for you. And so I'm still okay with if you want to interrupt and ask questions, that's totally fine, but just know that I'll be speaking with you versus showing you slides at this time. I do want to give you an update about my role as Public Health Director. At this time, it's important for the Public Health Department to be able to continue to move forward without a lot of disruption. As you know, COVID cases are the highest that they've been during this entire pandemic. We fear unfortunately, that this will continue throughout the winter. It's going to be a long winter when it comes to COVID and this pandemic, and we need consistency right now as we get through this tough time. So with that said, I will continue on as the public health director through the winter months and into the spring when we will open up this process to search for a public health director. In the meantime, because it's going to be difficult to take on two big roles, we have a very strong incident command team, and I have lifted up Deputy Incident Commander Laura Anderson, who is the health protection manager within our department, to be the incident commander for this pandemic. And I've also asked our administration manager to be moved into a deputy role within the department. Her name is Diane Holmgren. She's actually a city employee. As you know, we have a few city employees who are still here within the public health department. Our team is strong. I have no doubt that we'll make it through this winter and work with our community and all of you, but just wanted to make sure that you knew about how we were getting through this at this time.
Well, and congratulations on that promotion as well. I did know that. So thanks for recentering that, and I appreciate understanding where we are in the process to replace you. And congratulations.
Thank you. I appreciate it. All right. So for the past 8 months, our performance has been measured by a new virus, by our ability to stand strong during this pandemic at a time of uncertainty and change, and truly play a role of civil servant during this unprecedented time. The health and economic impacts, as you all know, of COVID are the greatest impacts in any of our lifetimes and will be with us for years to come. We in St. Paul and Ramsey County and public health have collectively been leaders and partners across our city, our county, our metro, and the state during this pandemic. As I highlight a few of our challenges and our opportunities moving forward, we do have available for you our 2020 and 2021 budget located at ramseycounty.us, and you can click on your government and then click on budget and finance, and you can find information about where we're at within our budget. As you know, Ramsey County Board approves the budget for a public health department. The county's budget cycle is not quite aligned with the city's. So we have adapted our second year budget, which is our 2021 budget, to reduce spending in response to the economic hardships of this pandemic that they've caused for our community. Our landscape has dramatically changed, and we are in the midst of documenting our public health performance in the context of our emergency response to this pandemic. We are what we like to call a full-service public health department. So divisions within our department include administration. They deal with their contracts and grants, among other things. Clinic services. Not all public health departments in the state have a full-service clinic within them. Correctional health. So we run the correctional health aspects within our jail systems. No other health department in the state does that. We also have WIC clinics. We have an environmental health department, which also makes us unique. Some of those departments in other county and other county systems and city systems are within a public works department. Healthy Communities is our prevention arm. Health protection is where all of our practice for pandemics come into play. And then family health is where we have our home visiting nurses. We have 336 FTEs and a budget of $56 million, which is a combination of grants and levy. And then we reside within the health and wellness service team within the county system. As we move through this pandemic as a public health department, we ask ourselves questions like, how many staff have been deployed? How many community members have been engaged? What percentage of Black, Indigenous, people of color have received what they needed to protect themselves and their families? How many people have access to a timely COVID test? How many of our residents get what they need when a case investigator calls them on the phone to talk about their positive tests? How many outbreaks did we identify and slow down? How many clusters did we identify? How many more people who may have been exposed to COVID-19 were found through our contact tracer process? Are we positively impacting knowledge and behavior? Can we increase the level of trust within communities where language other than English is spoken, or for those who are Black and brown but have had negative experiences within government? And how have we worked with community to better address their needs through testing through this novel virus? Are people truly better off because of our work? And are they better off because of our partnerships? These questions are the reality of our public health work for the next year or more, and we plan to document this performance through the Ramsey County data portal for this point in time. That will really, truly be historic. Our services have adapted, some have dropped off. We need to answer the core questions. Again, is anyone better off, and who are we missing? This is an opportunity for us as a public health department to rethink what we are measuring, how we are measuring it, how we share power with community in decision making about what measures we use and what strategies we use, and how we adapt our programs and services based on these new outcomes. While we'll continue to measure previous performances and performance measures in our work for the years to come, our current role is to lead this pandemic space, and we need to adapt to the relevant needs of our community. It's also important for us to look at new measures around reduction of gun violence, number of flu vaccines provided, COVID-19 vaccines provided year after year. We're really focusing right now on this year, but this is something we're going to have to do for years to come. Are we able to continue to reduce the number of yearly infections and deaths? Methods for reducing opioid use through medicated assisted therapy and are high on our list of strategies. As our city county public health department, it's important that we work strategically across departments when addressing community public health needs. Councilmember Prince, you recently inquired about the increase in opioid deaths. We recently learned that there's been an increase in the death rate in Ramsey County this year compared to last year, and it's not only because of COVID-19, but it's because of overdoses. Investments in non-traditional methods of addressing community mental health issues by increased partnerships with police and sheriff are areas of concern and focus for us. And the number of Black and brown mothers and fathers that have been engaged through programming and services to reduce disparities and increase resources for children and families are also areas of work that we can move forward. We continue to invest in the system of waste reduction, reuse, and recycling through a residents-first approach to address behaviors and actions taken right at home. We're investing in technology that will allow Ramsey County to gain more value from its waste, keeping 89.6% of waste out of our landfills. The passage of a recent bonding bill will bring $7 million to the Ramsey and Washington Recycling and Energy Center for facility upgrades. These upgrades will help purchase artificial intelligence technology that will be able to pick out a specific type of bag that you will use in your homes when you throw food scraps in the trash. This special bag will be thrown into your garbage with the rest of your waste, and it will be taken to the Recycling and Energy Center. Once there, the artificial intelligence or the robot will be able to identify the special food scraps bag. It will take it out of the assembly line and it will place it in trailers to be composted, keeping waste out of our landfills. We continue to better understand how trauma, racism, and discrimination impact the health of our community. As an example of this, we continue to track breast and chest feeding rates, and I'll get to how this is connected. But breastfeeding, of course, benefits both baby and the parent. Overall, in 2019, Minnesota WIC's percentage of people who breast or chest feed at 3 months was 48.8%. And we find many of our WIC families in Ramsey County who are breast or chest feeding at 3 months are significantly lower than the state's percentage, with only 33% of African American parents and 23% of Hmong parents breastfeeding their children. There are many reasons why people choose to or choose not to breastfeed. Some of those are outside of the influence of our WIC program, and some of which are culturally and trauma-based reasons. For example, when a decision centuries ago was made to make Black women breastfeed white babies, the choice to later breastfeed your own children either wasn't possible, it was exhausting, and/or it was traumatic. And these feelings and practices are handed down generation after generation, sometimes without knowing the actual reason why large percentages of community just don't breastfeed their children. Knowing the culture, history, and trauma within our community can allow us to do better and work with community to address health disparities. Community engagement is so important in how we do our work. We're currently doing this by having community liaisons provide education and resources for COVID and investing in trusted messengers like our county's racial equity and community engagement response team. We know there are historical and traumatic reasons why people may not want to get COVID-19 tests or fearful of an upcoming vaccine. Having an understanding of trauma and historical decisions affect the health of Black and Brown people and Indigenous people, and help us to better understand why we are seeing higher infection rates and death rates within COVID-19. This is why we invest in diverse staff to work within the public health department. When staff are of and from communities, when it comes time to connect with communities to provide education and help direct people to the COVID-19 testing sites, there's already a trusted connection there. Both the pandemic and the recent response to the killing of George Floyd have illuminated chronic problems within our national public health and government systems. Recent headlines over the past couple of years, and most recently the last few months, read, public health funding falls despite increasing threats. Public health's falling share of U.S. health spending. The impact of chronic underfunding of America's public health and hollowed out public health systems face more cuts amid virus. Council members, we are grateful to you and our county commissioners, both who have consistently invested in and supported public health and racial and health equity. And we're grateful to the leadership of our city and our county who have trusted our local public health leaders and staff to carve a path through this pandemic. Many of you continue to play leadership roles at state and national levels through associations and networks. We need your help now more than ever to press for change. It's not okay that Black and Brown people in our community and in our communities across the nation are suffering and dying from COVID more. And it's really not okay that anyone's suffering and dying more. But there shouldn't be racial disparities. Around 2 to 3% of national government health spending goes to public health prevention. That's barely a drop in the bucket. So we need your help to push for more flexible spending from state and federal grants so dollars can do more. And we need help allowing healthcare and public health to work more together without red tape and barriers. An example being not being able to get a COVID test at any clinic that you choose or that's close to you because you don't have the right insurance or any insurance. And providing more resources to prevention so that we're not reacting to emergencies is critical. On a local level, we continue to work and partner within and among departments and service teams within the county for more prevention, and we know you're working on to do that too. The public's health improves when we keep children and with their families, when we invest in public infrastructure like roads and we create more walkable communities, when we invest in better and more housing, families can stay together, when we increase access to libraries and parks, our community is healthier. And I know that you are all working toward those things. As I stated before, responding to a pandemic has created an opportunity for us to really take a look at what we do as a local public health department, how we engage and serve the community, what services we focus on, and how we measure and document our work. We'll begin the process towards our 2022 and 2023 budget in the coming year, and we'll continue to invest in and build up the Healing Streets Project, which is a group and gun violence initiative that brings public health models and healing practices in to reduce group and gun violence. To date, community grief circles, partnerships with the ambassadors and St. Paul Police, along with community organizations, have been moving forward. The team is working to hire neighborhood change agents, and work with schools and hospitals will be added in the next year. We're grateful to all of you for the city and county partnership in this area. Council members, you are all so actively engaged in your communities, and you see the need for Healing Streets, and many of you sit at the table with us in this partnership. We appreciate that. We appreciate your partnerships as we build this prevention program together. In closing, I could not be here and give you this update and provide this information for you if it weren't for the hard work of our dedicated staff in public health. 70% of our staff have been deployed into this pandemic response. Staff are being pushed to give a lot. We're working to make sure they have what they need to do their jobs in addition to their pandemic work. It's not always easy to navigate. We're all doing this, of course, for the first time, just like you are. And everyone has been responding to this pandemic for 8 months now. And they're so amazing, but they're a bit tired. This is hard work. We train for this, but no amount of training prepares us for some of the despair that we have witnessed within our community. So as COVID gets closer to each and every one of us, and it will, It's important to continue to remind ourselves that we are working to protect each other, our families, our friends, our colleagues, our neighbors, and our community. And it's hard. And we're doing this while the rest of our lives continue on. So if it's possible to be excited about this work and exhausted and energized and kind of crazy at all the same time, I think that's about where we're at. But we'll continue to move forward and do what it takes to get our community through this. I appreciate your time and attention, and I'm happy to answer questions or talk about things that I didn't get to cover in my remarks this morning.
Thank you so much, Ms. Hedin. And I think I appreciate the presentation. And as you were talking, I was thinking about how this presentation fits in our budget conversation, as opposed to our policy and kind of sometimes in the spring we talk more about the bigger picture and how things tie together. And so I'm going to think about that a little bit. We have questions from Mr. Tolbert and Ms. Prince. To start us off, Mr. Tolbert.
Yeah, thank you, Council President. Thanks for joining us, Ms. Hedin. Obviously, it's been a unique year where the Public Health Department has been highlighted, like, at least in my 8 years, 8+ years on the council, it has never been highlighted before. It shows the importance of having a Public Health Department. Could you talk a little bit more specifically about what you're seeing in our community and with the spread throughout Ramsey County, specifically St. Paul, just a little more specifically, so we can start with that basis here today. I think it's important. You know, obviously we've had great leadership on the state level, and we see state numbers fairly frequently. And I know you have a great dashboard that I look at all the time. But could you just talk about it from your public health perspective?
Absolutely. Thank you, Council President Brendmoen and Councilmember Tolbert. I appreciate both the comments about just kind of the scope of the remarks, and also appreciate the question specifically to COVID. So really right now, what we are focusing on, and what the state is actually focusing on as well, is getting information out to very specific age groups. So we are seeing a really rapid increase in COVID test positive cases between 18 and 35-year-olds. And so right now, the biggest push is to get young people to go get tested. With the new saliva testing site that's open at the Roy Wilkins Auditorium at the River Center, it creates more access and less of a barrier to get tests right now. And that is really the one way that we can make sure that we are getting people in so that they know they are either asymptomatic. 40% of this group presents asymptomatic. So it's a huge number. And to be walking around and not knowing that you have COVID and that you're spreading it, it's important to make sure that people know. What we are finding out behavior-wise for this age group is that when they learn that they have COVID, they follow the directions and they isolate. And so that's why it's really important to be getting this group to testing sites to get them to understand whether or not if they have COVID so they can quarantine and isolate. That is the biggest piece. The other piece is continuing, to mask. There's a lot of data out there about how effective masking is. There are some really great videos to show if you had, 10 people in an indoor room who didn't have masks on and one person had COVID, how many people, most of the people in that room would then contract COVID, whereas if everybody had masks on, only 2 or 3 people would get it. So continuing to wear masks, whether they're cloth masks or other type of barriers, is also a key message that we're putting out there. And then, of course, making sure that we are on the ground and we are specifically working with cultural communities, Black, Indigenous, POCs as well, because there is where we're seeing the highest disparities in cases as well as hospitalizations. I know young people feel that they'll get this and it will be fine, but we're also seeing young people who are being hospitalized. So again, it's important for us to be messaging to right now, specifically this age group. Also because we're moving into holidays of Thanksgiving and winter holidays where a lot of families come together, it's really important to make sure that we're vigilant right now to make sure that people are social distancing, masking, and getting tests.
Great. Thank you. And just, I have a few more questions if that's all right, Council President.
Yeah.
The testing obviously is very important, and the turnaround time is too. What are you seeing in terms of turnaround time? Just from people I've talked to recently, I'm hearing 3 days to get the text or or more. And obviously we opened the new saliva, the state opened the new saliva testing location in St. Paul. But what can we as a county and a city do to try and speed up test results? Is there anything we can do at this point? Is it a resource issue? Could you kind of articulate what that's about?
Yes, thank you, Councilmember President and Councilmember Tolbert. So some of our nasal swab sites, because they use the lab typically like at Mayo, it's taking a little longer because of the sheer numbers of people who are getting tested. So it's a good thing that amount of people are getting tested. The hard part is waiting the extra day or so to get those tests back. The good part about the saliva testing is that the lab for Vault Health is in Oakdale, Minnesota. And so it takes 10 minutes to take those specimens down to that lab. They are telling people that the results will come back within 24 to 48 hours. They are telling practitioners that it's likely within 24 hours because it's so close. So if people want to know right away, I would say go to that saliva testing site. It's open Monday. It's open every day of the week. During the weekdays, it's open from, I believe, 12 to 7. On the weekends, it's 10 to 4. And there are plenty of appointments. If there's no appointment on that day, they do take walk-ins. So it's okay to go down there. You can park for free on the top layer of the city center parking ramp and then go on in and get yourself a test. So it does vary depending on where you get your test and where the specimen gets sent to. The saliva testing right now is probably going to be your fastest result.
Okay. And just one more, and then I know my colleagues have questions. I probably have a few more before we're done, but could you talk about who should get tested? I think, a lot of Minnesotans think, well, I'll stay at home, or that I don't want to waste a test on me if someone else needs it. What is the best advice to tell people of who should get tested and when you should get tested?
Thank you for that question, Councilmember. Anybody should get tested. Everybody can get tested. Children can be tested at the saliva testing site. They can also be tested at our Aldrich Arena site and our community sites that we have that pop up at either the Mexican consulate or at some local churches. If you have symptoms, you can go get tested. If you don't have symptoms, you can go get tested. At this point in time, what the word that we use to talk about this is surveillance testing. It's not necessarily being promoted as surveillance testing, but the more we know about who's getting tested and who has it and who doesn't, helps us as a public health department to be able to focus our education and focus, if we're seeing clusters or we're seeing pop-ups in neighborhoods, to be able to connect with communities to get messages out there to go get tested. So everybody and anybody should just take a moment, and if you have time, to go down and get tested. If you have symptoms, you should absolutely go get tested. It's not going to harm you. It's not going to hurt you to do that. In one space, you're providing a specimen into a container. In another space, at our Aldrich Arena, they use the half nasal swab. So it's not the one that pokes you in the eyeball. It goes just halfway up the nose. I've had it done before. I was okay. And so it's fairly painless. And so I just promote anyone going and getting tested right now.
Thank you.
Is that good, Mr. Tolbert? All right. I see Ms. Prince and then Mr. Tao have hands up. Ms. Prince?
Ms. Sedin, this is incredibly valuable. Thank you for being available for all these questions. That is some of the most straightforward, helpful information I've gotten about COVID testing yet. So thank you for that. Thank you as well. Earlier in your report, you mentioned the increase in opioid overdoses, and this is something that just really knocked my socks off, because I met with our East African community who was deeply, deeply concerned about this, and parents are needing to understand what they should be looking for, and even in terms of cultural traditions or ways the household works, is they don't tend to lock up their medications. I mean, that is just one example that, to me, we have some teaching to do there. So thank you for following up on that. The magnitude of your job is amazing. I mean, from recycling to dealing with the COVID crisis, and then to the crime and corrections issues. And that's the other thing I just wanted to bring up quickly. You probably saw the article in the Star Trib on Sunday about the terrible increase in youth violence in the Twin Cities. And I have been in conversation with a mom who is just really struggling with the fact that her son, as a 15-year-old, is kind of collecting felonies and is not experiencing any consequences, which does come up in that article. So we are really needing Healing Streets to get off and running. And I just wondered if you could give us any update on where that is right now. And if there isn't a lot to report, or if you want to get back to me on that, that's fine. But it is just such a growing concern, even, not only for our communities, but for families whose kids are getting swept up in this wave.
Thank you, Council Member Prince, for the comments and for the questions and the concerns. And definitely our Public Health Department has a lot going on. There's a lot to keep up on, for sure. And I appreciate that recognition. With Healing Streets, right now, the group connects with the mayor's office every other Monday within a meeting that is led in that space around the crime and safety and justice group. There's many other organizations and resources and departments within the city that attend those meetings, and so they give regular updates there. And I know there's a connection as well to Councilmember Brenmoen and Councilmember Tao regarding work that happens specifically in other neighborhoods within the community. The group, so we have a contract in place right now with Restoration Inc., and they are helping to lead work around grief counseling and grief work. That's more of the intervention piece. So after violence happens within the space, connecting with families on both ends of the violence, those who have perpetrated violence and those who have been victims of it, to bring some healing into that space. We know that when that piece is left undone, it creates further harm years and years and years down the road. And so being able to address the need for families to heal in that moment and beyond is really important, and in a way to set a family into a completely different trajectory. So that has been in place for some time, and I know that there's community healing circles that have been taking place in different areas within St. Paul. We are working through our system as well to bring on community navigators. So these are people within community who have already established connections with community, who can connect with the family that you spoke of, who do know the people who, who are experiencing just a really tough time right now, and connecting with youth as well, to make sure that we have people in place. It's not nearly enough and not nearly fast enough, but as we navigate this pandemic space and as we navigate making sure that we are addressing group and gun violence, we are getting there. Those are two things that we're working on. Also having connections again with the St. Paul Police Department, making sure that we're connected with the gang unit there, continue to connect with Director or Joel Franklin, with ambassadors. Those are common connections that take place between Danny Givens and Mark Campbell, who are the two staff people within Healing Streets as well. So we continue to move it forward. Again, any suggestions and connections and comments, I'd happy to take those and pass those along to Healing Streets group as well.
Thank you very much, Ms. Sedin. I appreciate that update.
Thank you. Mr. Tao, and then Ms. Naker.
Thank you, President. Director Heaton, thank you for all your hard work. I know that we could be at a worse place, but what I've seen is that Ramsey County has been very responsive, and so I really appreciate you and your team. The question I have is that I know you talked in some detail about work that has been done in communities of color, and some of the folks. English is a second language. Let me finish this. And so last Thursday, Soitu Vang, who is the former president of the Vang Council, he just passed due to COVID, and he's not alone. There's still Hmong members of the Hmong community in Ramsey County that are still getting the virus, still dying, and I mean he's in his 50s, right? And so what have we been doing that has worked well, and what more do we need to do to prevent these? Is it enforcement? Is it education? I'd love to hear your thoughts on that.
Thank you, Councilmember Tao, for the comments and the questions. And yes, I had heard about the passing of Mr. Vang, and I'm extremely sorry and saddened by that. And unfortunately, there's going to be more, which is just so difficult. And so it is so important to make sure that we are connecting with communities. We are able to track where infections spread. The Minnesota Department of Health is able to do that based on information that is provided in the case investigation and contact tracing. So sometimes we can see that when there's big celebrations that take place, we see that's where spread starts. And so for specifically within the Hmong community, that has been a very important piece of information that we're trying to continue to connect and provide education on. It's important for families and communities to be able to figure out ways to gather with social distance in mind so that they're not continuing to spread COVID infection, because this is the reality, is that people will get sick and that people will die. And so we do have many people who we've brought into the department. Either they already were working here, or they are here working with us in community outreach, or we've contracted with organizations like Hmong American Partnership and KOM, as well as some of our other local clinics to make sure that we have people who are of community, who are working within community. It doesn't make sense for me to walk into one community where I don't have a connection or I don't have a relationship. So making sure that we are investing within communities so that they are the voices and the trusted messengers within the spaces. We have been in local food markets. We've been in cultural centers within our city to make sure that we are providing education so that people can hear from the public health department, here are the things that we need to be messaging and looking at around masks and social distancing. We've provided over 60,000 cloth masks specifically to communities of color, as well as one-time reusable masks to businesses to make sure that people have access to masks in our communities. As we know, that's one good barrier and one way that we can help keep each other safe. More needs to be done, though. We do continue to see disparities in hospitalizations within Black and Asian communities around COVID. So we continue to make sure that we're investing in the right education and that we're getting out into community and connecting in multiple places. And again, if there are organizations and people that you want to make sure that we're connected with, I'm happy to take that information from you as well.
Thank you. It looks like Ms. Yang.
Thank you. I had a question about where we can find the most up-to-date data and information about some of the work that you all have been tracking, like you mentioned, like looking at families who are doing breastfeeding, and then now like the death rates and overdoses as well. Is that something we can find on the Ramsey County website?
So thank you, Councilmember Yang, for asking the question. Where you'll be able to find that as we build it is within the Ramsey County's open data portal. So if you go to the Ramsey County website, I think you can click on that front page, open data portal, and then you can just search what you're looking for. It needs to be built. And so as we work through this pandemic, but also move forward and we have more staff available, that data will become more available in more of a story version within our open data portal so that people can find it. If you can't find what you're looking for, we ask that there's usually a contact us, put it in there so we can get that information updated in that page.
Okay, thank you.
And
Thank you.
before we switch over to Ms. Naker, just following up on Ms. Yang's question, I was mentioned this at the top of our question section here, but I think that just listening to what Ms. Hedin has presented, that there is an opportunity for us to have a policy conversation where we delve into some of the subject areas that she mentioned in her remarks as part of our typical spring policy conversation. If there's, as you look into this, Ms. Yang and others, if there are particular areas that we want to learn more about, Ramsey County St. Paul Public Health is a combined department. And because it's not part of our budget per se, we don't naturally have a place that we talk about this. So I think we have to be intentional about it. And if there's things that pique our interest, we by all means should be clear what those questions are and bring Ms. Hedin or her successor in to have conversation about those. I know there's a few things that have already popped up in my mind that I certainly need more information about. Ms. Naker, thank you for your patience.
Thank you, Council President. Thank you, Ms. Hedin. I want to just double back on a question that Councilmember Prince asked a few minutes ago, back to the Healing Streets and gun violence intervention work that your department is doing. And first of all, I really appreciate and support the public health approach to the youth violence epidemic that we are seeing right now. It is, I think, the right approach. But I'm concerned because it seems that we invested a great deal into Healing Streets, and we have been asking for specific results from that program for a while now. In June, so 5 months ago, we did receive an update from the administration at that point saying that things had been delayed due to COVID and hiring was happening. What I just heard you say to Ms. Prince was that meetings are happening and there's a contract. I guess I'm wondering, do you have more specific data on how many young people have been talked to, how many circles have been held? Do we have outcomes to report, or if not, do you know when we can anticipate seeing the actual outcomes that have resulted from this work so far?
Councilmember Naker, I appreciate the question and really appreciate digging in for specific outcomes. I'll get that to you. This, as you know, prevention work is difficult work to count. There's not a lot of widgets that you can count when you are measuring prevention. It's hard to count something that didn't happen, right? So, but what you're asking for is more metrics in the day-to-day, and we're working with an evaluator within our system who also has been redeployed to evaluate CARES funding and to evaluate work within this pandemic. So we have to work with sharing time here, but our evaluator is working on a way to provide these metrics so that we can give more regular updates to you and to the administration on what we are working on. I know that Healing Streets reports information to the administration on those Monday meetings, and so if there are things that have been created already, we can try to figure out a way and a mechanism to get that information to you all as well.
Thanks. And I agree with you. I mean, I think at this point, I'm just looking for outputs, not even outcomes, numbers of meetings held, that kind of thing. And I think, one very, very specific request would be if we can be included on that communication that goes out every Monday. I think I certainly would be interested. And if that can be shared with us, that might be an easy way to keep the council in the loop.
It's a great suggestion. Thank you.
And I want to underscore that, and I'm jotting down notes to that end. We have been, I can certainly understand how it feels like that communication is being relayed back to the city if there's a every other week meeting conversation, but the council's not at the table. And so we have not been privy to that information. And that communication breakdown is, I think, largely on this side of the county city equation, but something that we're as council members are very deeply invested in. And I think understanding again, actually what steps we're taking to move forward, because of course, planning and preparing takes a lot of time, but we're looking for, so how are we engaging? Where are we engaging? Who are we partnering with? And so to have that conversation on a more regular basis, and we'll work on how we piece that together on our end, and then also be more intentional about connecting with you and your work. Ms. Prince, your hand is up again.
Yeah,
Okay.
to that point, and this is not a question for Ms. Hedin, but I mean, I really think to this whole conversation that it's time for an update at our city council meeting. I would request that we put it on our November 18th agenda because our communities are asking about it. And just to bring up that Sunday Trib article, I think it is really top of mind for our constituents. So I think that we need to have some reports back and make that a regular thing. And at least for this year, we have not had a report at the council on any of our community first public safety efforts since they have started to be implemented. So I'll make that request here. I hope that we can put that on our November 18th agenda for a report from the administration and whoever it's appropriate to have be part of that in terms of our partners.
I agree. It needs to be on our agenda. Without looking at we have a week off in between, so I don't know what the 18th looks like. But I certainly and wholeheartedly agree that the time is come due and overdue on that report. Mr. Tolbert. Oh, Mr. Tolbert, your mute button is on.
I'm sure it's profound what I said. So, like I said, I have a few extra questions here. Back to COVID-19 and our response to the pandemic, which is affecting everything we're doing, obviously, including this meeting. The city of St. Paul has been some of the first in terms of setting up restrictions, whether that's a citywide mask mandate and things like that, which obviously have expanded as it should have to a statewide mandate. Are there any things that you think we or the county should be doing that could help try and contain the virus more than we're doing right now? Obviously, we're seeing the states around us are seeing such spikes, and we're starting to see the spike as well. And the third wave, everyone thought it called it the second wave until now the third wave. We're starting to see it, and it's going to be a long winter, and the numbers are scary. What suggestions do you have, since you have the policymakers here at the city level at least, and obviously we don't have full authority, the state has more authority than we do, but what things could the city or county policymakers be doing from your public health perspective that could be helpful?
Thank you, Councilmember Tolbert, for the question. This is where my public health answer probably will get me into trouble with the economic answer. But if you look at when we had a shutdown in the state, think about what those numbers were around COVID and when we decided to shut down back then. We are astronomically higher in cases right now than we were during that time. We've been working with the St. Paul Public Schools. We have a schools team branch that works with all of our schools within our county system to help them understand the recommendations from the Minnesota Department of Health and the Minnesota Department of Education into what it would mean to move from a in-person to a hybrid to a distance learning. And they have done an amazing job, specifically Dr. Gothard and his team within the school district, of trying to balance both the COVID cases and what it would mean to have that many children in schools. And they, as you know, made a decision not to bring anyone back for some time into January. And from a public health perspective, that's the right thing to do. It's a difficult thing to do because we know that there are consequences for families. How many children are home right now while their children are at work? How many kids are actually turning on their screens, and doing their work with nobody there with them. These are difficult decisions, and so a shutdown clearly is a difficult economic decision. But it kept people home and it kept the rate low. I'm not suggesting that is where you all go with this, but this is from a public health lens, we need to be doing something to keep people away from one another. And that's so hard. As we are social beings, we want to be connected to one another. The reality, though, is that we're not seeing a ton of clusters within businesses and within, places that were shut down previously. And so that's certainly not the answer to go back to what it was, but we need to be doing something to be able to help people social distance. It's really about those backyard gatherings, the connections in your neighborhood, people coming together and kind of distancing for a little bit, but then we get used to hanging out with one another, and then, there we are. We're also continuing to see healthcare workers who are also now contracting COVID outside of healthcare in the community setting, and then they can't work and they can't provide the healthcare needs within our healthcare settings, which also creates issues there. So I didn't answer your question fully. It's a hard answer, clearly, to give at this point. It just something needs to change around stepping back a bit and looking at what the reality is right now.
Great. And what would you say if you're advising people? What should their rule of thumb be if they're thinking about doing activities? Obviously, there's some activities that are required, and some jobs are required to see other people. But what rule of thumb in people's personal lives would you recommend that they use?
Yep. Continue to wear a mask. Continue to be at least 6 feet or more away from people as you are working with them, if you can. That's important. There are still sports and activities that are allowed to happen because there's not a lot of contact and they can stay far apart. Continuing to wear those masks, again, in those spaces are really important in what's going to help keep people safe. Even if you have had COVID, it is not ruled out that you can't get it again. So continuing to follow the same precautions as well, to social distance, to mask, to stay home when you're sick. And if you've been exposed, make sure that you quarantine and connect with your, healthcare and physician as well.
Okay. And then I just have two more questions. I haven't read about it in the paper recently. What is kind of the status of PPPs or PPEs? You know what I'm talking about?
Yes. Yes.
I know we had shortages early on, we don't want to get beyond ourselves, but are we still seeing those shortages, or has the manufacturing and logistics line kind of worked itself out?
At least for us at this time, as a county system that has purchased PPE, we are not experiencing shortages. There still is a lag in when you need to order and when those things actually come in. Face shields, I would say, are a little hard to get. But again, usually only people wearing face shields are those who also should be wearing a mask and are in a space where they need to keep their eyes covered. Right now, I think for the most part, we have what we need to be able to provide any type of assistance within our county. But, as our cases continue to go up and those get utilized more quickly, we'll see kind of how that goes.
Okay. And then my last question, some of the doctors and nurses who reached out to me throughout the pandemic seem to be getting anxious again with numbers, as we've talked about, and cause for concern. What are you seeing in terms of space at our hospitals and other clinics? Where are we at with that, and how much capacity do we have right now? Thanks.
Thank you for that question. Capacity is becoming slim. We know of somebody within one of our residential systems who was having problem breathing and was sent to the hospital. The hospital sent them back because they don't have beds. That was at Regents. So it's also around the same time where there's a lot of injuries and there's a lot of other needs for hospital beds. And so beds are filled up by non-COVID patients as well as COVID patients. I have colleagues too who work in our hospital system. They are also very anxious and worried, which is why we need to be continuing to social distance and wear masks and do our best to not spread COVID. Because we are getting to a place across the entire state, which wasn't the case earlier this year, where our hospitals and clinics everywhere are finding it very difficult, and our surrounding states are in the same spot. So, thinking about transferring people out of state to a hospital system is becoming out of the question.
Thank you.
Thank you.
All right. Are there any other questions for the budget in particular before we shift gears to OTC? Okay. And as I mentioned, Ms. Hedin, there is a lot of I guess one thing in particular would be we don't have a PowerPoint presentation, but you shared a lot of information and it seemed like you have prepared remarks. It would be helpful if you could just share your remarks with us so we can look back and, I think I was trying to take information at a pretty quick tempo. So if there's a way that we can get those prepared remarks, we can look at them, which may also help prompt some of the questions. I know I heard a budget number that I wanted to know a little bit more about, et cetera. But I definitely think with the hiring of a new public health director in the spring would be a good time to invite you back to talk about our policies and policy questions and the work that you're doing and that you're that will be moving forward under new leadership. Sounds like maybe in the spring. That would be fantastic. So thank you so much for your presentation. Obviously, the work of Ramsey and St. Paul Public Health really weaves into all of the work we're doing, as you touched on economic development and better outcomes and our equity goals, and everything is kind of ties back to the role that you've played and the department plays in public health. So thank you very much for helping bring us up to speed, and we look forward to speaking with you again.
Perfect. Thank you, Council President.
All right. Okay, so we are at 10:55 on Wednesday, and we have a next budget presentation is from our OTC. We have Director Sharon Kennedy Vickers in the House with a presentation. So I will turn things over to OTC.
Good morning, Council President Bryn Moen and council members. OTC, I think it's my understanding on September 15th, our department, some of our department leaders presented a presentation, and there were questions, more detailed questions around the digital transformation. And so we prepared a presentation to provide more information around the digital transformation proposal. At the request of the mayor, OTC did propose new investments in resident-facing digital services. We know that we will be entering into a multi-year period of increased financial pressure and increased reliance on digital services. And so that it's critical that we invest in new digital tools and that we also maximize technology as well as our talent investment and streamline business processes to eliminate waste. We put together a digital transformation roadmap that will harness data and technology in ways to achieve two primary goals. Our first goal and most important is to improve the residents' experience and engagement with the city of St. Paul. We want to make it easier for our residents to access information and the services they need when they need it. And we also want to make it easier for our residents to engage with the city, making their voices heard in City Hall. And secondly, we also want to make it easier for our public service, you and I, to be able to deploy those services and make decisions for maximum impact and, most importantly, maximize our operations. Our plan that we've put together represents three primary areas of OTC, the services that we provide to the city. The first being digital services, which is centered on co-creating and developing information technology applications that deliver user-focused digital services. It also ensures that we protect the city's investments, our data and our systems, hardware. We want to make sure that those are secure. So security is a part of this plan and how we will invest the funds that have been provided to us. We also want to ensure that we make investments in the infrastructure that is needed to ensure that our employees can conduct the business of the city anytime and anywhere. And this plan is further broken down into several other services, and I'm going to go through that in this presentation. And it also provides us with the details around the capabilities that we need to meet the residents' expectations. So the first area that I mentioned was digital service. Digital service consists of 4 primary areas, which is constituent services, lifelong learning, resident engagement, as well as lifelong learning. And so I want to speak to our first area, which is constituent services. Our constituent services, again, is really focused on transforming the way that our residents access services and the information that they need. As I stated earlier, we want to make it easier for our residents to be able to engage with us and do so in a manner that's convenient for them as well. And so the first part of this is something that I'm really excited about, which was the stpaul.gov updates that will happen and occur next week. I think we will, and Amanda can correct me if I'm wrong, I think next week we will release the new website for stpaul.gov. For the last 18 months, we have been working on not only upgrading the system, our web content management system that we utilize for stpaul.gov, but we've also did a branding refresh. But most importantly, we have really focused on creating a stpaul.gov that's centered around the user's need and not around department silos. And so we were focused on not just the aesthetics of our website, but also focused on the functionality and usability, and wanted to make it easier for our residents to access the information that they need. And we wanted to build the groundwork and framework for us to start to utilize our website more as that portal for information and access to services. And so as you see here in our presentation, and you guys will have access to this, we discuss how these and the services and the projects and initiatives that we're going to work on not only impact our community, but also our city residents, our city staff as well. So our first will be stpaul.gov web updates. We spent 18, I would say, the last year and a half really digging deep, talking to our residents, talking to department leaders, and we've structured the website in a way that's going to be highly beneficial to our residents. The other piece of that, the next piece of that will be service hubs. We will spend some time next year, and we've already started this process through research as well, developing Service Hub and creating a unified contact center for non-emergency service requests. What we are hoping to do here is to basically create this bi-directional communication for our residents. A lot of times our residents submit requests or have a request, and that information goes through several different departments, and it may be difficult for our residents to get the information that they need in a timely fashion. And our hope with this Service Hub is to make sure that our residents are able to get real-time feedback and progress on the resolution of the request that they've submitted. The next piece of that is, or the foundation for that, is for us creating a service library. We want to compile department information and put it into a central repository so that our city staff have the answers to the questions that the public so often needs, and having a central repository and a system to hold and house that will make it easier for our city staff to be able to get that information. This repository will also have a resident-facing component as well that will allow for some self-service for residents for some of the common and frequently asked questions. And finally, we need a way for our residents to be able to submit applications or information and upload that to our staff, upload to our city staff safely and securely. Next slide, please. Next is our economic opportunity. We, as you are aware, that the city has a licensing and permitting system that has, we have been wanting to and are in need of upgrading. In 2021, we will focus on upgrading and getting a single solution for our permitting and licensing, and making sure that our business owners are able to apply for, renew, pay for their licenses remote and online. The other piece of this, and we did this work during the pandemic, was to ensure that city business was able to continue. We were not able to be physically in a space to sign, and so we've implemented a system so that we can get and obtain electric signatures. Next slide, please. The other piece is public engagement. I spoke earlier around constituent services, which is allowing our residents to access service. But with public engagement, we want to implement solutions that will allow residents to provide input. In 2019, we implemented a solution that allowed us to open up the CIB process and allowed resident input into that process. And we want to expand the use of that, work with various departments who would like to increase the engagement with the public and allow them to use a platform that facilitates that. And finally, for the digital service area is lifelong learning. As we know, the pandemic has required us to work and deliver our services in new ways, and I think in the education and the learning space is the one where that is really visible for us. And we have OTC, we've work with Libraries Park and also St. Paul Public Schools to develop digital platforms to allow us to deliver the services that we typically deliver in person in a digital platform. And so we work with St. Paul Public Schools. We understand the students use the G Suite, the Google Suite. And so we've stood up a G Suite within the city to allow, and so we want to expand that and work with our Parks and Library to utilize that service to provide digital services. And finally, we want to continue to work with Parks and Rec and to expand their Right Track program, and making sure that program is able to continue to operate and provide the services that they need in the digital space. The area that is one that's critical and very important for me, and one that keeps me up at night, is security. And, through the pandemic, we have seen an increase, as well as during civil arrest, an increased need to be very vigilant and hyper-focused on cybersecurity. And over the past 2 years, OTC, we have been working to mature our security program and improve our security posture. We had new investments in 2019, and with those investments, we have been able to move our program forward in some really good ways. In Q1 of 2020, we completed a security assessment that by a independent agency, and with that assessment, we were able to identify gaps, threats, and potential risk for our environment. And in Q2 and Q3 of this year, we developed a security strategy that allowed us to address those threats that were identified in our security assessment. And so our security strategy is really has like 5 different areas, which is the identification and detection of those threats, protection, working to modify and change the behavior of individuals in our in the city, and response and recovery. And so over in 2021, we will continue to make investments and really focus in this area. A few of the things that we will do as it relates to identification and detection. We want to continue to roll out our two-factor authentication for all remote access scenarios. We want to increase or strengthen our web browsing traffic as well, and we want to also contract with an independent party to do a penetration test. And there are improvements that we will make in this space. And what we want to do is always, test the things, enter into this continual cycle of doing the work and testing and making sure that what we're doing is meeting that need. And so we'll have a pen test for all of our critical infrastructure. As it relates to protection, people and their behavior, we know that I would say over 80%, I think it's probably closer to 90% of our security compromises happen through phishing. And that means that our staff, they're our first line of defense against a cyber attack. And so we want to increase the education. And so we want to implement a formal cybersecurity awareness and communication program in the city. And we also want to develop and create a cybersecurity council at the leadership level to help ensure that we are really working to change the behavior and providing some enforcement around some of our cybersecurity policies. And finally, we all know that, we have to, a lot of this work is being prepared in the event of a threat. And so being able to have a response and to be able to recover that. And so we're going to really work on, testing, again, our backup procedures and making sure that we have a plan in place in the event of attack on the time and the order in which we will restore some of the critical services that can be disrupted with a cyber attack. The last piece of our plan is infrastructure. Similar to our, roads and bridges, our infrastructure is basically the backbone of our network, and it makes all of the things that we do possible. And at the city, we have to make investments into our infrastructure and wanted to, provide more information around our network and what makes up our network. The ability to connect to the internet, to connect different locations throughout the city and the different wards, as well as being able to connect devices within our buildings, and also having our visitors to our buildings to be able to connect to the internet, to have connectivity that is made possible by our network. And so we have to make investments into our networks, and our plan includes that. Joe, can you advance to the next slide for me, please? The other piece of our infrastructure is the compute. We have seen an increased demand on our compute power, with I would say, a large percentage of our workforce working remotely. And so a part of our infrastructure is that compute power, the servers or the systems that are in the cloud, and the ability to connect to those systems are a part of that. The final piece of that, next slide, please, is storage. all of the information that we gather and collect has to be stored. And that, again, we've seen an increase in that through the pandemic, and with more digital services coming online, we'll know that. Another important piece of that is that in the event of a cyber attack, data has to be backed up and stored. And when we are talking about restoring and bringing those services online, our data, our storage capacity is a large part of that. And so we restore from those systems. And so it's important for us to continue to update and increase the storage capacity that we have at the city. And I would say traditionally our approach has been to make large investments or infrastructure updates. What we are proposing is that we annually, over every year, make investments into our infrastructure, and so that we don't put ourselves into a position where we have outdated infrastructure, or we are not able to manage the capacity that we will have with these increased services. And so with that, I will pause there and wait for some questions. Can't hear you.
I'm looking to see if there's questions. I'm not seeing any at the moment, but I'm curious, given that this is a budget presentation, if you have a slide that just speaks directly to the budget.
So in this presentation, we have, in our previous presentation, we had broken down the cost. I'm pulling that up here really quickly.
Thank you.
So for digital services, I think our total expenditure is $668,000. And so we are allocating $428,000 to digital services. We will allocate $100,000 for security and $140,000 towards our infrastructure.
Okay, and I appreciate that, just putting it back into context. I know there was unanswered questions, but just, as we're piecing together the budget, I think it's helpful to understand that particular context. Are there other questions from my colleagues or comments? I'll ask. Okay, Ms. Naker, thanks.
Thank you, Council President. I'm having some issues with my hand button today. And thank you, Ms. Vickers, for presenting to us. I appreciate it. I'm just wanted to clarify, because I think my colleagues might have this question, and I know you and Councilmember Prince and I had spoken yesterday about this, that some of the work that it sounds like you're interested in doing in the service hub sector in particular aligns very closely with the topic that the audit committee and that the city council has decided to investigate this year, which is constituent and customer services and how to improve those. And I know we had talked just yesterday about the opportunity for that work to really complement what your team is thinking of doing. And I'm excited to have those things work together. So I just wanted to say that on the record, because I know there might be some questions about, well, isn't this very similar to the work that we already decided we wanted to look more into?
Thank you, Councilmember Naker. Yes, and we do believe that there is an opportunity for us to collaborate, and that the work that you're doing will complement the work, and we appreciate the opportunity to work with you on achieving the goals that we have set out with our digital transformation roadmap.
Great, thanks for that clarification. Are there other questions or comments at this time? Okay. Well, it looks like we do not have follow-up questions on our follow-up questions. Again, we're working on setting our final budget on the beginning part of December, so things may pop up, but at this time, I think we really appreciate getting this information and clarification, and I'm interested to learn more as we navigate the audit committee topic and the work that you're doing and making sure we're complementing each other, not stepping on top of each other and duplicating efforts unnecessarily. I think that this is one of the reasons why these presentations are helpful, so we understand what your focus area is. So thank you for that. So if there's nothing else, thank you very much for being here today. We appreciate it.
Thank you.
Right on. And I am having, I don't know if you guys have ever had this, but like where notifications from another meeting keep popping up in the chat box over the corner here. So I wasn't seeing Mr. Tolbert. Unfortunately, he did not have his hand up. All right. So there is nothing else that is on our agenda today beyond the two report outs from Public Health and from OTC. So seeing that we've reached the end of our agenda, we are adjourned. We have a council meeting today at 3:30. Look forward to seeing everybody. Thank you.